I'll focus really in on the chronic MPNs, polycythemia vera and essential thrombocythemia as the topic of our educational session at this ASH. And the therapy for these agents of these diseases has actually not really evolved significantly in the last 5-10 years, and most of the treatment really is aimed at trying to reduce the risk of thrombosis in these patients, as that's the leading cause of both morbidity and mortality. So there's a lot of understanding about exactly which patients should be treated with cytoreductive therapy and which cytoreductive therapy is most important to be used. And there has been more data now about using interferon therapies and ropaque interferon, and specifically in the PV population, to see if this really improves outcomes in terms of mutational burden, but also event-free survival, which we cover too. There are also novel therapeutics that are in development in PV and ET that are really interesting and scientifically and clinically impactful that are being highlighted at this ASH, including hepcidin mimetic therapy with Rusfertide, which is a really exciting concept, really pioneered by my colleagues. And this will acts as basically a chemical phlebotomy, but also can control hematocrit levels at a steady rate and potentially really improve symptoms and long-term outcomes with patients with polycythemia vera.